Hi, everyone. Good morning, good afternoon, good evening, for wherever you're joining us from. As you're joining us and as we're waiting for others to join us, please do introduce yourself in the chat. Let us know where you're calling in from. Let us know your name, your organization. We're really delighted to have you. Make sure you select all participants so everyone can see you. Great. We have about 100 participants on the call, so I think we're good to begin. Welcome to everyone, passionate advocates and supporters of parents and caregivers from around the world. My name is Shekufe Zanji. I am the Global Technical Lead with the Early Childhood Development Action Network and also a member of the Global Initiative to Support Parents. So on behalf of all GISP partners, we are delighted to welcome you to today's webinar on strengthening universal parenting support, developing a policy analysis and benchmarking tool. It's organized by the members of the Global Initiative to Support Parents, and I'm sure you can find information about us online. With that, just a few housekeeping things before we begin. If you have questions, please do use the Q&A chat. If you have, you want to share resources and you want to share your contact information, definitely do that through chat. With that, I'm delighted to kick off this very exciting webinar that's going to showcase this exciting tool that we have been working on over the past couple of years. And to kick off, please allow me to introduce you to Shima Sengupta. She's the Director of Child Protection from UNICEF. Over to you, Shima.
Thank you so much, Shakufe, and my sincere appreciation to ECDAN on behalf of the Global Initiative to Support Parents for this introduction and for bringing us together today. It's really such a privilege to be part of this community of partners who are collectively driving forward this global agenda on universal parenting support. In that vein, we wanted to give special mention to Parenting for Lifelong Health and to the governments of South Africa, Serbia, Mexico, UAE, and Zambia, whose support in developing the policy analysis and benchmarking tool that we are launching today has been instrumental. It's in this spirit of collaboration that UNICEF and its partners have been intensifying efforts to place parenting support at the center of child and family support systems. This is rooted in the strong and consistent evidence when parents and caregivers receive high-quality support, and it could be through group programs, through home visits, through community networks or other integrated services, children actually benefit across every domain of development. They're healthier, they're safer, and more resilient. Yet, despite this, global monitoring shows that only around a quarter of countries have parenting programs that reach all who need them. This gap between knowledge and implementation remains wide. Against this backdrop, and in response to a growing global policy consensus, UNICEF commissioned the policy analysis and benchmarking tool for universal parenting support. It was conceived of following the 2021 UN policy call issued jointly by WHO, UNICEF, and the SRSG on violence against children. This call urged governments to adopt a minimum package of evidence-based parenting support with universal reach. That policy call highlighted parenting support not only as a child protection intervention, but as a public health, social inclusion, and human rights priority. The momentum that was generated by the policy call was further accelerated last year through discussions at the first ministerial conference to end violence against children in Bogota, where policymakers, practitioners, and researchers came together to advance the shared commitments, including on parenting and caregiver support. Many stressed the need for practical tools, something concrete that countries could use to understand their current landscape access gaps, and shape a long-term strategy. So the policy analysis and benchmarking tool responds to precisely this demand. This tool, what does it do? It provides governments as well as subnational partners, planners, civil society, and network of service providers with a clear, structured, and evidence-informed way to analyze the state of parenting support in their context. It lays out a number of policy domains, each with a benchmark and associated indicators, enabling partners to identify strengths, gaps, and areas for improvement. It's also intentionally participatory, a process that brings sectors together, builds shared understanding, and supports coordinated planning. And because countries differ widely in their governance structures, it is flexible. It's adaptable to federal systems, to humanitarian contexts, and to diverse political settings. Importantly, the tool is not intended as a mechanism for comparing countries, nor does it assess service quality. Instead, it enables policy level and structural view of what is in place and what is needed. When revisited over time, every 3 to 5 years, it allows governments to measure their own progress, refine the plans, and guide systemic reform. Again, I do want to say we are incredibly grateful to the governments and partners in South Africa, Serbia, Mexico, UAE, and Zambia, whose work to pilot the benchmarking tool has enhanced and strengthened the final product. We're delighted that some of these countries are with us today and that we will have a chance to learn from their experience. Today's webinar is the second in a two-part series designed to introduce key resources to support the delivery and scale-up of universal parenting support. Earlier this month, and Christine, we will talk to you a bit more, we launched the Global Parenting Support Framework. These two resources are designed to work hand in hand. The conceptual framework sets out the vision and principles, what universal, progressive, evidence-informed parenting support should look like across a child's life course. And then the policy analysis and benchmarking tool provides the practical mechanism, a way for countries to understand where they currently stand and what steps are needed next. Together, they both offer the why and the how for aligning policies, systems, and community-based efforts, helping create the supportive environments that enable families to thrive. And this work forms part of a wider global movement. As we look ahead to the Global Caregiver Forum in January, where governments, practitioners, and caregivers themselves will convene to reflect on progress and ambition, tools like this will be essential. They give countries the ability to come to global forums with clear evidence-based assessments, to exchange practical insights, and track progress together about what it takes to support parents everywhere. In this sense, the policy analysis and benchmarking tool is more than an assessment instrument. It is a catalyst for collaboration, a roadmap for action, and a means for advocating for the systems that enable all children and all caregivers to thrive. And so with this background in place, I will now hand over to Christine, who will walk us through the structure of today's webinar and introduce our speakers. Over to you, Christine. Thank you.
Thank you, Shima, and thank you for setting the scene so clearly. Before we move into the substance of the tool, I just wanted to briefly walk everyone through how the session will work today. So we'll begin with a short overview from Sarah Thacker, who's representing Parenting for Lifelong Health, on how the policy analysis and benchmarking tool was developed, including the standards that it draws on and how the piloting process was carried out. We'll then, as Shima said, hear directly from three of the countries that piloted the tool: Mexico, Serbia, and South Africa, each of whom will share reflections on how they've used it to date in their own contexts, what they learned through the process, and how it's helped strengthen thinking and action on universal parenting support. We'll have the chance to close with a question and answer session where all three country representatives and PLH will be available to respond to questions about the tool itself and also about the piloting experience. And we'll finish with a few final reflections and next steps, including how you can begin using the tool yourselves and to continue to engage with this work. So with that, I'm pleased to invite Sarah from PLH to take us into the next segment. Thanks, Sarah. Over to you.
Thank you so much, Christine. Good morning, good afternoon, and evening, everyone. My name is Sarah Thakur. I'm very excited to be introducing you all to the UNICEF's Policy Analysis and Benchmarking Tool for Universal Parenting Support. I'm grateful and honored to be representing the wider team and colleagues from Parenting for Lifelong Health who co-developed and tested this tool. Next slide, please. So a big thank you to Shima for already sharing the background and context. So that allows me to get right into it and tell you a bit more about the tool and the process for completing it. So very quickly, what is the main aim of the tool? So the tool aims to provide a structured approach for analyzing the policy environment. So it essentially lets one analyze the availability and the quality of parenting policies, offering benchmarks that help identify strengths, gaps, and areas of improvement in national efforts. So the benchmarks itself are based on global standards, guidelines, and evidence that are complementary to UNICEF's Global Parenting Support Framework that was just launched a few days ago. And the tool also offers direct links to such evidence, global guidance, frameworks, and includes targeted information about topics discussed in the document itself. Next slide, please. So piloted in Mexico, Serbia, South Africa, Zambia, and the UAE, it serves as a resource specifically to governments, so it could be at national or subnational levels, and it encourages meaningful dialogue among stakeholders at all levels. It helps kind of establish a shared vision for action and potential scale up. Most importantly, it enables governments to measure progress over time. So the tool can be completed at any given point and revisited years, months later to assess how policies have evolved and how new initiatives have contributed to advancing universal parenting support. So it does so by analyzing 10 domains, each with a benchmark and corresponding indicators. Next slide, please. So here are the 10 benchmarks and domains. So these are rooted in international human and child rights frameworks and global parenting guidance from UNICEF, WHO, and other partners. And each benchmark represents an essential component of delivering parenting support at national scale. So they're further divided into 3 indicators, which I'll show you on the next slide, highlighting key subcomponents of each benchmark. So each of these benchmarks are designed to be interactive. They're designed to be reflective, allowing stakeholders to assess and present the current environment for scaling parenting programs and interventions towards universal coverage. So I like to think of it sort of as a checklist. It's important to highlight that this tool analyzes the policy and the enabling environment, not the parenting interventions or the services itself, making it super valuable for assessing system scaling readiness. So very quickly, what are these domains and the benchmarks? So we first have legislation and policy. So this ensures parenting is supported by national laws and policies. We have leadership and coordination, ensuring that we have strong national leadership and coordination mechanisms that are already established, supporting parenting convening. We have evidence-informed programs, so requiring parenting programs to be evidence-based and evidence-informed and adapted to the local context. We then have tiered approach to parenting support, so ensuring parenting support is available at different levels of intensity, so universal for all, targeted for those with additional needs, and intensive for high-risk families. We have scale and sustainability, so ensuring that strategies address scalability, sustainability, and long-term impact. We talk about use of delivery platforms to support scale-up, so that's integrating parenting support into existing systems and services. We have parenting workforce, so ensuring that there is a strong, well-supported workforce to deliver parenting programs sustainably. Public financing, demonstrating government commitment through adequate and sustainable funding specifically allocated to parenting support. And then we have data and monitoring, so making sure that we have systems in place to gather and use evidence to track quality, effectiveness, and impact. And lastly, we also analyze social norms, so addressing harmful social norms and promoting positive nurturing parenting practices across the life course is also analyzed through this tool. Next slide, please. Thank you. So, yeah. So each benchmark, as I said, includes 3 indicators that further explain the benchmark. Since we only have a few minutes today, I won't get into much detail, but I've expanded 2 domains here for your review, just to see as an example. So the tool is presented in a tabular format. Country teams, so that may include government representatives, consultants, and any other stakeholders, are encouraged to rate each benchmark and indicator from 1 to 4. So 1 being not in place and 4 being that all elements of this indicator are in place. They are then encouraged to write down the source of the information. So where they found that information, was it through desk research, research online, or through consultations? And then we also have the notes section. So the notes section helps document evidence, clarify definitions, capture different perspectives, and note important contextual details for the team that might attempt the tool next after a couple of years. So this ensures future consistency and helps track progress over time. So while these indicators may seem comprehensive and we recognize that each country context is different, teams are encouraged to adapt the language, contextualize the checkpoint, identify or actually analyze what the definitions mean for themselves, and basically completing this tool depending on what fits their national situation. Next slide, please. So going into a bit more detail regarding the process of completion, the teams are advised to start with the preliminary mapping. So this helps kind of teams understand the landscape, what programs, policies, and stakeholders already exist so that the tool is applied in context. The next step is identifying key stakeholders and securing their buy-in. So it's really, really important to bring the right people to the table. So this includes government decision makers from ministries like health, education, and social welfare, civil society organizations implementing parenting programs. It could also be academics, researchers, could even be donors. And it's really important to maybe even bring parents and caregiver groups, especially those representing marginalized communities, as well as humanitarian actors. So involving diverse stakeholders ensures a more complete and meaningful analysis of the tool. Step 3 is establishing a working group. So this could be a new or an existing coordination group that oversees the process. Step 4 is where a working group would sit together to review and analyze the benchmarks. So ideally, this could be done collaboratively to ensure everyone has a shared understanding of the definitions, adapting them where needed to national terminology, and to foster collective decision-making. If that's not possible, this could also be done through smaller focus group discussions, smaller roundtable consultations, informal or formal workshops, and consultations. So finally, the results could then be compiled into a country report or format suitable for further planning and advocacy, maybe something like a scaling roadmap. So again, while this is not meant to be prescriptive, it is the most comprehensive way to complete the process. Even a light touch version can be adapted based on the resources that are perhaps may only cover a desk research based on the country's needs and context at the moment. Next slide, please. Similarly, the timeline for completing the tool depends on the depth of analysis and the methods employed for data collection. So teams should determine the timeline based on the availability of resources and the capacity. The outcomes, however, are quite significant. A participatory process like this can really, really lay the groundwork for advocacy and strategic planning around scaling and institutionalizing parenting interventions. It also helps countries develop a national roadmap to scale towards universal parenting support, strengthening collaboration and alignment across sectors. And finally, it provides a way to track internal progress over time towards achieved national goals. I'm very excited that we have 3 country teams here today that participated, actually led the pilot, who will be shedding more light on their own process and outcomes. For now, that's it from me. Thank you so much, and over to Christine.
Thank you, Sarah. So yes, we're now going to move into the section of the presentation in which we'll hear more about the piloting process in Mexico, Serbia, and South Africa. And we have a mixture of representatives from UNICEF and also from partner governments who are going to tell us a bit more about how they use the tool in their own context and what they learned through the process and how it's helped to strengthen their thinking and action in moving towards universal parenting support. So first off, I'm happy to introduce Rocio Aznar-Daban, who is our Child Protection Chief with UNICEF Mexico. Over to you, Rocio.
Good morning from Mexico City. Many thanks, Christine, for the invitation. The benchmarking piloting exercise was conducted in 2024 in Mexico from April to August, importantly at federal level, but also it was conducted across 3 states of the federation. Partners that were involved include the Ministry of Interior, Public Safety and Security, which is the police, Women's Ministry, Social Welfare, Family Welfare, the Child Protection Authorities, civil society, and the National Child Rights Coordination Mechanism. So it was quite wide. Among the enablers that were found within the benchmarking piloting exercise in Mexico include the strong national and state level buy-in, meaning that there is a very wide and important interest in promoting positive parenting and parenting support programs across states and at federal level. Also, we found a proliferation of parenting interventions and actions, plans and strategies, not necessarily around parenting support or parenting programs, but including the concepts, and very importantly, within a very solid institutional framework and infrastructure which exists in Mexico. Parenting programs were found in the health, in the education, and social protection sectors. And also the benchmarking exercises, the exercise noted significant advances in the legal framework, very specifically the incorporation of the definition of positive parenting in the reform of the general law on the rights of children and adolescents, passed in 2024. On the other side, among the withholders, were identified challenging universal parenting support in the country, the lack of a governance mechanism and effective coordination. Not a single ministry is clearly in charge of coordinating the efforts. And on top of this, we have the decentralized federal structure in the country, which means that despite having maybe national frameworks which include parenting support or partially in parenting programs, that doesn't mean necessarily that the programs are and the services are delivered at municipal level. On the other hand, we noted a lack of sustained funding and a silo approach to parenting intervention. So each ministry and agency undertaking initiatives in a non-coordinated manner. And without a common framework of results. And this absence of a cohesive cross-sectoral strategy has limited the ability of programs to harness synergies and optimize resources and ultimately have an impact at scale. And on the other, as you can also see on the slide, there is the very widespread notion that child abuse or child discipline of corporal punishment at home is not a public problem, but a domestic one. Next, please. So the process we followed to conduct the piloting entailed four phases, 4 stages. The first one, in the first place, the benchmarking tool was tailored to the local context, and a set of methodological tools was developed, such as questionnaires, concept note, workshop methodological charters, and so on. Then a desk review was conducted, including the review of parent support policies, existing programs, legislation, evaluation reports, academic studies, statistics, and journalistic references. Then a participatory evaluation process was followed with 113 national and subnational stakeholders being consulted and participated in the focus groups and semi-structured interviews and consultation workshops which allowed a joint review of the benchmarking tool and helped build ownership, trust, and support for the tool. And finally, after systematizing the information, the outcomes and findings were presented to the participants to validate for validation, promoting transparency, accountability, and strengthening government ownership and buy-in. So it is important also to note that the long participatory method promoted ownership, as I was saying, and more participants, and pinpointed areas for enhancement, such as very specifically intersectoral coordination and the need for effective governance structure and a clear lead and a framework of results. It promoted interinstitutional coordination and collaborative spaces where different institutions and sectors converge to find synergies and break the silos. And the advocacy efforts informed by the pilot's findings contributed to ongoing efforts to integrate principles of respectful parenting in national programs and policies, as I will mention in a moment. Next, please. Some of the lessons learned really include that as a federalized system, it is vital to apply the tool nationally but subnationally as well, since, as I was saying, the services are provided at municipal level, and also state structures and programs have an impact on services provided at the municipal level where the children are. The long participatory consultation helped build ownership, as I mentioned before, in critical areas were identified requiring attention to improve effectiveness and sustainability of parenting support policies and programs. As I was saying, in particular, intersectoral coordination, governance, but also cultural adaptation, given the very large indigenous populations in the country, and financial sustainability emerge as a priority areas for future development. I have to say that the results and findings of the benchmarking have informed policy development processes, very particularly the development of the new early childhood national development plan, also the first 1,000 days national program and the child rights national program. But also I can say that 7 states in the federation are now looking for developing parenting state plans with UNICEF support, among others. 2 of them have included parenting already in their updated state development plans. And we have more than 4 ministries at the federal level now implementing parenting programs based on the evidence. So I will leave it here in case colleagues have questions afterwards. Thank you very much.
Thank you, Rocio. Super interesting, particularly to hear how the tool worked in this federal context. Next up, we're moving to Serbia, and I'm delighted to introduce Daniela Biella, representing the Ministry for Family and Demography of the Republic of Serbia. Thank you for being with us, Daniela. Over to you.
Thank you, Christine. And I wish to say good morning, good afternoon, and good evening to all participants. My name is Daniela Biella, like Christine said, and it's a pleasure for me to join on behalf of the government of Republic of Serbia and Ministry for Family, Welfare and Demography to share Serbian experience piloting the parenting support benchmarking tool. In the next few slides, I will try briefly outline our national context, how we conducted the consultative process, the key findings, and the direction we see for strengthening a more coherent system of support for families. First slide is about country context. Serbia has a strong institutional foundation for advancing parenting support, with a dedicated Ministry for Family Welfare and Demography, providing a clear anchor for placing families and parenting high on the national agenda. Parenting support is addressed across several interconnected systems: health, education, social protection, family welfare, and youth, each contributing important elements to family well-being and nurture care. In addition, Serbia has an established system of family-friendly policies and financial benefits, including a parental leave provision for both mothers and fathers also, which create enabling conditions for positive parenting. Also, more than 40 strategies and normative documents already refer to parenting support in a different ways, reflecting a clear national commitment and a growing recognition of parenting as a public policy priority. Please, next slide. About methodology. The benchmarking process in Serbia was conducted through a highly consultative and inclusive approach. Key national stakeholders working in early childhood development, family support, and later adolescence services were also actively engaged through expert meetings, interviews, and structured discussions. The process focused on reviewing existing policy and programs, also identifying both strengths and areas for further development, and jointly reflecting on current practices across sectors. Findings were validated through intersectoral workshops, ensuring shared understanding and consensus, and the exercise results in a baseline overview that can inform future policy planning and system straightening. Next slide, please. The findings show that parenting support is clearly recognized as a policy priority in Serbia and reflects across multiple sectoral strategies and legal framework. At the same time, while many strong and evidence-based programs are in place, the overall system remains a little bit fragmented, with initiatives often operating in parallel rather than as a part of a unified framework. Importantly, Serbia already has a universal entry point for parenting support, particularly through the health system and family financial benefits, which provide a strong foundation for reaching all families. However, the benchmarking highlights that while access exists, those intensity and continuity of support are not always sufficient. This is partly linked to workforce capacity constraints, including the limited number of professionals and competing responsibilities in. At the same time, there is a strong and visible momentum. Serbia has a wide range of credited, evidence-based parenting programs, particularly in early childhood, delivered through platforms such as home visiting services and development facilitating units. Innovative digital solutions, including Bebo and Čuvamte, are further expanding access to parenting information and support, complementing in-person services to helping reach family at scale. Finally, social norms are gradually shifting toward more nurturing, non-violent parenting practices and more equitable parenting roles, providing a strong foundation for continued system strengthening. Next slide. Lesson learned. First, there is a clear opportunity to develop a unified national action plan for early childhood development and parenting support, building on existing initiatives, clarifying leadership roles, and ensuring sustainable financing across the sector. In parallel, the development of the national strategy for the prevention and protection of the children from violence represents critical next step. Under the leadership of Ministry for Family Care and Demography, this strategy provides a coordinated national framework to strengthening institutional roles, align sectoral actions, and reinforce Serbia's commitment to creating safe and supporting environments for all children and their families. Strengthening leadership and intersectoral coordination would help translate strong policy and programs into a more coherent system, enabling professionals across sectors to work towards shared outcomes for families. Improved data system also and indicators are also needed to better track coverage, quality and outcomes, guide decision making, and connect digital platforms with service delivery systems. Finally, while universally entry points exist, additionally focus is need to ensure progressive support pathways so the family with greater need can receive more intensive and sustainable support, particularly those in vulnerable situations. Thank you very much for the attention. Christine, back to you.
Thank you, Daniela. It's excellent to hear this progress and the role that the tools played in helping to shape the future direction in Serbia. Please do stay with us for the Q&A portion of this webinar. We're looking forward to hearing more. With that, we're going to move now to South Africa, and I'd like to welcome Kereleng Motsamari, who is representing the National Department of Social Development of the Government of South Africa. Thank you for joining us today, Kereleng, and over to you.
Thank you so much for the invitation. Good morning, but here in South Africa, it's good afternoon. I think I'll also be sharing the key findings and outcomes of the parenting benchmarking tool, which was conducted in 2024. The first slide. In South Africa, we have over 20 million, living in the country. And South Africa's, social protection system is made up of a bucket of social grants, which serve to protect the most poor and vulnerable members of our society. Over 13 million children receive social grant, as the results of the social protection system that we have. And in South Africa, we also have, a diversified, family structures where we have nuclear families, extended families, and multi-household arrangement. But there's also a graph down there, that also shows, the kind of family structures that we have, where we have neither parents, mothers only, fathers only, or both parents. And you can also see down there, it's also broken down, in terms of the provinces that we have around South Africa. We have 9 provinces. So the state is also broken down according to all the provinces that we have. And as a country, we also have a strong policy environment, having ratified regional and international instrument, and also our policy, our national constitution, which is also upholding the rights and of everyone in the country. And we also have the revised white paper on families, which also advocates for responsible parenting.
Kereleng, we don't see your video. If you're able to turn it on, that would be great.
Oh, okay. Can you see me?
Wonderful. We can see you now. Thank you.
Okay, thank you. Yeah, in terms of the methodology on how the piloting was conducted, the National Department of Social Development, as UNICEF, they reviewed, and co-created the terms of reference for the pilot. A reference group was also established with government representatives from, the Departments of Social Development, the Department of Education, and also the Department of Health. And, UNICEF, South Africa also was assisted in terms of guiding the process. The following, were conducted, which also culminated into a national report. Number one was the stakeholder tool adaptation workshop, which was also convened, the desk review process, key informant interviews, reference group, on rating the benchmark, by the reference group, sorry, validation of rating the benchmarks, participatory consultation of draft findings with key stakeholders. Can we go to the next slides? Which talks to key findings and outcomes. Can we proceed to the next slide? The key findings and outcomes, what was also what became the outcomes was basically that we need to strengthen leadership and coordination. There's a need, for the establishment of a multi-sectoral coordinating body so that it can oversee all the parent support effort across different departments, because in all the departments, we also have, directorates that talks to parent, but it's quite important that we also have that, a coordinated effort, so that, we work together, and also to develop financial plans and dedicated budget lines. We need clear national financing plan that should be developed, that would also include dedicated budget lines within relevant government departments. We also need, a catalog, of parenting programs. We need to create and promote the National Directory of Parenting Programs and Support Services, that must also be accessible on digital platforms and also online. And it's also quite important that we should also print it so that, we have a wide reach, and especially for those people, who do not have, the gadget. We also need to improve monitoring and evaluation. We need to develop standardized and uniformed data collection tools and systems, for longitudinal measurements of programs and effectiveness. Lessons learned and future directions. We need a timely contribution, to our collective efforts to promote child well-being through enhanced parenting support, prompted reflection on progress. We need to check, what has been made, and also check the gaps and opportunities, for more action. The pilot offered significant insight and recommendation to strengthen parenting support. Political will is also key to advancing parenting support initiatives. During the first Global Ministerial Conference on Eliminating Violence against Children in Colombia, the Minister of Social Development, Ms. Dolashe, highlighted parenting support as a crucial component of the broader strategy to eliminate violence against children. We also need to strengthen collaboration and coordination with other key government stakeholders. That was also done, with the Department of Health, the Department of Basic Education, through the establishment of a reference group. But that was also done, in consultation with other civil society organizations. The launch of the country report during the October month, which is the Social Development Month. The report was launched, by the Deputy Minister of Social Development, raise awareness of universal parenting support as a multi-sectoral priority. I think that is something that is also, on high, especially in terms of, the problems that, the children are currently, experiencing. So, parenting is also at high, because it's quite important that we should also, support parents, so that they are able to fulfill their job, collaborating with UNICEF in the development of an implementation plan for the recommendation from the report. The process has already started, where we are also working with UNICEF, Currently we are also intending, to map out, whatever existing work, that has to do with parenting. So thank you so much.
Thank you very much, Caroline. Fantastic presentation and reflections, and happy to say that we will have the chance to hear more from you because we have about 10 to 15 minutes now for some Q&A. I'm going to invite all of the speakers to turn their cameras on. We have 2 great questions already in the chat, so I will start with those ones, and please feel free to either open your mics or to type your questions in the chat and I will come to them. So I'm going to go first to the first question, which is a great one and one of the key challenges in this kind of work. So the question is, the intersectoral collaboration work is recognised as essential for parenting and most public health challenges, but it's also the most difficult to achieve, sustain and finance. Do presenters have some insights on what elements worked in their countries? Thanks. So I'm going to turn first to Daniela, if that's okay, to offer some reflections from the Serbian context. And then Rocio, Caroline, if you have any reflections, and likewise, if Sarah, if you want to come in from your perspectives of overseeing this in all of the countries, please do. But first, over to Daniela.
Thank you, Christine. Thank you for the question. I will say that when there is a clear leadership with one ministry ready to coordinate, the process becomes easier. It's easier to collaborate between sectors, And this is supported by existing experience in Serbia with the cross-sector strategies, including those on the protection of children from violence, also those from protection of children with disabilities, also including children, persons with disabilities, including children. So it's very important to be cooperative between ministries, between sectors, and between states, like we do today. And it's like continuously meetings and sharing experiences and trying to find together solutions for all those sectors that are included in these specific areas. So maybe my colleagues also can give some better answer than me. This is all about cooperation, and when it's the goodwill and institution and government, and this is also I also said that it is priority and in national policy in our country. So there is need to collaborate in every sector in every part of the important sector, like health, like education, like my Ministry of Family Welfare, and then and well-being also. So it's a together effort, and it's like need for all of us,
Thank you, Daniela. That was really clear. The points you made on the importance of goodwill, the importance of institutionalizing within policy and of leadership. And actually these points come out in the framework themselves in relation to how to sustain this kind of collaboration across sectors. So thank you. Can I invite Mexico and South Africa in case they want to add anything? Otherwise, we'll move on to the next question. Caroline, did you want to come in?
Yes, I want to come in. I think as a country, South Africa, we've realized, the importance, of, collaborating and coordinating our services. And, we also have the white paper on family, which also advocate for responsible parenting. The white paper also advocates that, it's quite important that we need to collaborate, with different organizations, including government department. And when you look on the white paper, it stipulates, exactly, what is, the role and responsibilities of various, government department, including the civil society. So we've also realized that, it's quite important if you want, to enhance our interventions, so that we support, universal parenting, that we need to come together, and, stop working in silos. But there's also progress regarding that we also have those forums where we meet, as different, service providers and come and share, good practice and share even, the resources that we have. But I still feel that we still need to do more in terms of that. Thank you.
Thank you, Caroline. That's really clear, and we really appreciate these real life examples to learn from. I'm going to move to the next question and invite Rocio from our UNICEF office in Mexico to come in on this one. Another really important question. It's generally easier to obtain public sector support for short-term pilots rather than for long-term commitment to strategies, policies, and corresponding funding. What can we as practitioners do to help catalyse long-term commitments from all parties? Rocio, would you like to come in on this one?
Sure. Many thanks. It's an excellent question. I think a few points from my end. First of all, I think getting the attention of the highest level possible at ministerial level is very important. At technical level, they may be engaged, they may be interested, but they don't make decisions. So getting that highest level engagement is very important, but also being present in the different, in the right moment, in the right fora, where the policy is made and where the development plans are developed. So that is very important. And for that, also building alliances with and between civil society and even private sector to come with one voice and present proposals as one. Provide, offer programs based on evidence. And I think that is our experience that has been very powerful. And also sort of offer relatively low cost interventions such as parenting programs that can be actually relatively easily integrated into existing servicing and platform services to reach scale. In all programs that are reaching communities and parents, from pacification plans or public safety plans to the Ministry of Women's plans, the health sector, and where they already have the personnel and they are already reaching families. So that can be easily integrated. Provide high technical assistance for policy making, it's also important. And for practitioners or civil society organizations, I would also add, last point is important to also to work with UNICEF, because UNICEF has often a place in decision making spaces. So I think I would leave it at that. Thank you.
Thank you very much, Rocio, for those insights. I'm going to turn to the next question, which comes from Aaron Greenberg, and it's about financing. I'm going to ask Sarah to come in on this question, and perhaps in response, Sarah, you could reflect a little bit on the complementarities and distinctions between the policy analysis and benchmarking tool and the Universal Parenting Support Framework, which was launched earlier this week. But the question is, was launched earlier this month. The question specifically is, please can you elaborate a bit on the financing landscape for universal parenting support, both in terms of cost to scale and where the financing will come from? It strikes me that these examples are still scaling, so any insights on this would be welcome. A very relevant question at the moment. So over to you on that one, Sarah.
Thanks, Christine. That is a really good question. And I think that's where the benchmarking tool really comes in, because it serves as a diagnostic to identify strengths, gaps, and opportunity when it comes to scaling, and especially around how to finance scaling. And you've got onto it correctly, where most of the countries that are presented are on the path to scaling and achieving universal parenting support. But the benchmarking tool actually identifies this as its own domain and benchmark, where you can essentially analyze specific indicators to make sure that your government is working towards sustainably financing and scaling parenting intervention. So, for example, I know I didn't go into too much detail when I was presenting, but some of the indicators when it comes to public financing is that there is a commitment to allocating national and federal either like decentralized or centralized level budgets to ensure sustainability and scalability of parenting interventions. So the indicators for this particular domain actually cover that government budgets at national and subnational levels allocate adequate resources for parenting interventions, that there are strategies in place to mobilize and use financial resources from either public, private, or international sources. And the third one being that there is a system of results-based budgeting that is established and includes dedicated financial resources for evidence generation, capacity building, outreach, and M&E for essentially delivering effective parenting interventions at scale. So while it may not be in place already, hopefully the indicators can provide sort of like a next steps or guidance as to what to achieve next from a systems level.
Thank you very much, Shara. That's a really comprehensive response. And just to say that the links for both the tool and the framework are in the chat earlier on. So please do go and take a look at the sections on financing in both areas. I'm going to open the last question that we'll have time for and ask the speakers from Mexico, Serbia, and South Africa to maybe give us a kind of 30-second response. The last question is, having pioneered use of the tool, how do the three countries plan to use it systematically to ensure momentum on enhancing the policy landscape for universal parenting support in each country? If I can perhaps turn first to Rocio, and then we'll move to Serbia, and then we'll move to South Africa. Thanks, Rocio.
Yes, thank you very much. So at state level, we will continue working with 7 states to develop their own state parenting support plans embedded in their different policy frameworks. And at federal level, we will support the government in implementing the National Child Rights Plan, which is called PRONAPINA, and this includes parenting. And we will continue working with 4 ministries at state level to implement parenting programs at scale. Thank you.
Thank you, Rocio. And if we hand over to Daniela now.
Yeah, thank you very much. It's very similar, like I said on my last slide. There is clear opportunity to develop a unified national action plan for early childhood development and also parenting support. But we are building on existing initiatives, clarifying leadership roles, and also ensuring sustainable financially across sectors. So it's very important that the development of national strategy for the prevention and protection of children from violence represents our next important and critical step. And this will be also the main point in Ministry of Family Care and Demography, and also like a main point in our government and priority policy. And this strategy provides coordinating also national framework, strengthening institutional roles, and that is so important for this issue, for this problem, for vulnerable families also. So cooperation and strengthening institutional law and also national strategy. That is I think our main task.
Thank you, Daniela. And Caroline, perhaps we can invite you to post your next steps, as you mentioned, into the slides, because we are going to have to close the webinar here. And there has been a huge amount of interest and lots of questions that we haven't had a chance to get to. So thank you for all of your engagement. But I wanted to close the session by offering a couple of reflections on the process of overseeing the development and piloting of this tool. And I think we've seen from the speakers today that at its core, the policy analysis and benchmarking tool responds to a really practical challenge that many of us working towards the provision of universal parenting support have faced for years. And that is that we know that parenting support is often one of the most effective ways we have to prevent violence against children and to generally to strengthen families and support child development and well-being. And we also know that in many contexts, efforts are fragmented, as we've discussed, across sectors, programmes and governments. And what's really been missing is that shared way to step back and look across the system and ask some of those honest questions about what's in place and what's working and what we still need to change. So as we heard in the introduction, this tool is not about scoring countries or creating comparisons. It's really about supporting reflection and dialogue. It's been designed to help bring together ministries, civil societies, service providers and partners around a common framework that's grounded in evidence and rights, and to support more coordinated planning over time. And I think it's clear from today's presentations that the process of using the tool is really just as important as the results that it produces. And the tool also reflects what we heard from countries during its development, the need for something flexible, practical, and adaptable to different governance structures, including humanitarian and decentralized contexts. And it recognises that progress towards universal parenting support is a journey, and that countries will move at different paces. And as we look ahead to the Global Caregiver Forum in Madrid and to the next phase of implementation, our hope is that this tool will be used not only as a technical resource, but as a catalyst for stronger collaboration and sustained investment in parenting support as a core component of systems designed to support children and families. Thanks so much to all the countries, partners and colleagues who contributed their time, experience and insights to shaping this work. We're really looking forward to continuing this journey together. Thanks again.